I have Dr. Errin Weisman, and today we're going to discuss her journey and what she has learned coming out the other side of burnout and moral injury. But more importantly, she's going to discuss how she's just being real and human, all the good, the bad, and the ugly that brings. Welcome to another episode of The Worthy Physician. I'm your host, Dr. Sapna Shah Hawk, reigniting your humanity and passion for medicine. Dr. Weisman, thank you so much for joining us.
I'm so excited to be here with you, lady. We had recorded on my podcast, and I was like, I need to know her more.
I could not agree with you more. And some of the passions that we share are primary care in the rural setting. Is that correct?
Yep.
Yeah.
When Dr. Glockenflecken is talking about the rural medicine rotations, have you seen those YouTube videos?
Yes.
Oh my God, it so resonates in my soul because I'm like, yes, that's 100% exactly what we do.
Yes. If the farmer's calling and he comes in
Shit's
without
got
his rifle.
real.
It just got real. It is.
Yep.
It is so
Yep.
true. And
I literally had a patient this last week who, we were done with his appointment, and it was one of those, he's like, I just got to tell you this. And when you have a middle-aged, hardworking, blue-collar man that says that, you got to sit back down and take the extra 15 minutes.
yes. Yes. And why would that matter as far as medicine? Because the system wants us to see a patient every 15 to 20 minutes, sometimes 10 minutes. But I think it comes back to human connection.
Absolutely. We don't, like we were talking about before we hopped on the recording, we don't take care of books. We don't take care of numbers. We take care of people. And there's a lot of times in my primary care office where I'm just meeting people where they're at. And that can be a really hard place. And you know what? That fucking takes time. You
Yeah, it
cannot
does.
meet somebody where they're at in 10 minutes.
No. No, you can't. A lot of times it's just, okay, what are your signs, symptoms? And here, try this medication. It may or may not work. Come and see me in 3 months.
That
And
doesn't feel good to me.
no, I don't think it feels good to patients either. I think a lot of patients are saying, I don't feel well, or I have this concern. Let's help me figure out what's going on and, getting to the root of the problem. And a lot of times it's an answer of just, changing lifestyle. And the patient buys into it because they're like, I'm already on 15 medications. I don't want to take another one.
Yeah. Sometimes I think too, it's so environmental and situational. Because I practice addiction medicine as well, there's so many times that I sit with people and I can look back now a couple years and I always tell them that. I'm like, how far you've come. You have done this from where you were at. I would have them on multiple mental health medicines in addition to treating their substance use disorder. And so much of, I think, our human being life is situational and where we're at and the people and things that are around us. And I think it just goes to show that even like you and I are sitting here with a substance use disorder, but they're talking about how prevalent and how mental health is not going away, even though people are accessing. And a lot of it to me, I have to get into what's home like for you? Do you feel safe? We started asking the in-depth social determinant health questionnaire about 2 months ago. And it's been so interesting, the answers we've gotten from people that I wouldn't have even thought to ask. Near homelessness. There's about cell phones. Let's be honest, that's a huge source of connection. It's how we pay our bills. It's how we find out important information. And so there's so many times that I'm not prescribing medication, really, if I'm really getting to the heart of some matters. Of course, there are times when medication's appropriate, but yeah, and our system is not built for time. It's not built for that.
No, it's not. And unfortunately, that really hinders the patient-physician relationship just because you don't have that time to build that trust and that rapport. But one thing that you were telling me before we hopped on the recording was that how has the way you've practiced medicine from when you started out of residency to now, how has that changed? If you could frame that for the audience, because I think that's very powerful.
Yeah. So you had asked me a really beautiful question, which was, what have I found most challenging with medicine? And I gave you the answer that it's both like internal and environmental. I went into this career, into college, med school, residency with the thought in my brain that if I worked hard enough and I did things exactly the right way, then it was going to work out. Be that schooling and tests and residency, like for me personally, because I don't come from a family of physicians or people in medicine. I come from good old hardworking folks here in Indiana. And so I knew I didn't want to struggle and have the honestly the financial struggles or the job struggles that I saw within my family. And so that was, I would say it a lot that like I may not be the smartest person in my class, but no one could outwork me. And it was something I very much prided myself on. And still to this day, I know that I'm a very hard worker. But what that did was really start to escalate what I recognize now as a work addiction, where if I just work harder, then things are going to work out because it was just like that equation work equals perfect situation. And I also translated that into patient care. If I gave people the very best evidence based, correct answer, medication, dose, all the things, then they were going to be fine and it was going to be so much better and they were going to be fixed. And I had so much nighttime anxiety, insomnia, even panic attacks, I would say, when patients would call in and they would be worse or something would be going on. And I would directly translate that back to myself. Oh, I did something wrong. I'm not good enough. I should know more. Yeah, to insert all of those like negative downward spiral of almost calling yourself worthless. And we use the word imposter syndrome. And I really think imposter syndrome is just the iteration of not having self compassion and letting that translate out. But having all those thoughts, and I supervise a couple nurse practitioners, and I see them doing that. They're young in their careers. They're like, one's just a year out, the other one's a couple more years out but trying to strive to do the very best thing. And what I keep reminding them is like, you're forgetting the human factor in this. That like you could do exactly what the book says to treat their hypertension, and they may still have a stroke from malignant hypertension. And we really have to get to the point that we understand like we don't control the equation. There are so many factors that are in that are invisible. We don't go home with patients. We can't make them take their medicine. Even if we do give them good medicine, they may have some crazy ass weird side effect that we've never seen with something that happens. Things just happen. And in order for me, I think to really overcome that, I circumvented, I didn't see this at the time, but it was really like learning that I'm doing the best I can. I'm going to empower the patient to do the best they can. And then also, no matter what comes up, you will know how to handle this. You'll either know what specialist to call, where to look for resources, referrals. Like this is figure outable. And I think since I've taken that approach in medicine and let go of my perfectionistic tendencies, it makes patient care more enjoyable. And also, I'm just better about informed consent with patients. Like, hey, this is what we're going to try. I literally say, this is a science experiment on yourself. I have no idea how this is going to turn out. I'm hoping my hypothesis is correct. And this is what the evidence shows us. But also, who knows? So just call me. And I think like giving that availability and that access to say, I'm not going to drop you on your head. And also, if side effects come up, we'll manage it, we'll figure it out. And instead of trying to be perfect and curtail all the potential bad things that could happen, it takes so much more pressure off of myself.
Yeah, so what you're doing is taking off the pressure and saying the results are based on my ability to be a doctor and saying, "Okay, we're gonna try this. It may or may not work." And there are other things that feed into this equation that are completely out of my control. And so by telling patients that, and it sounds like you're communicating beautifully with patients. You know what? We can try this. It may or may not work, but call. So that way we know if it is or not. Let us know if you're having side effects instead of waiting 3 to 6 months. And when patients know that it's okay to call or it's okay to page, because a lot of times, "Oh, I didn't know who to call after hours." There's usually a system in place, and just by communicating that with patients, that really takes a load off.
And I think too, in a world that everyone has an opinion,
Mm.
and everyone's opinion they feel like is fact, especially when they go online, everybody's swapping medical advice. It just gives some softness to what we're trying to do. And I think for me, trying to be an authoritative figure in my job, it just doesn't work. It didn't jive with me, like I said, just really struggled with it. And what I really realized is nobody has all the answers. We're all just like figuring it out. Keep that differential big and you just and really it's so much more like going with the flow, which I am 100% like I said, a recovering perfectionist, type A, probably a little OCD at times. Like that has taken years of just practicing and seeing how it does work out. And I think that's where as a younger clinician, I didn't have that behind me to be like, okay, pump the brakes. You got a little time with this, or like, you can manage the big bad things. And like I said, I see that in the folks I work with to try to help mentor them and say, it's okay if you don't start like 4 medications in one appointment, like just do one and then see them back and then do another one. Cause that's like the beauty of family medicine is that we are in the long-term journey with them.
Yes, you primary care is that long-term relationship, and I'm an internist myself here in rural Kansas. And one of the things that we were talking about beforehand is also the barriers that patients face, not just in a rural setting, which sometimes is a little bit different because access to specialists or whatnot is not as readily available as maybe in some larger cities, but just acknowledging and, like you said, meeting the patient where they're at and knowing that we're treating humans is so beautifully said, as well as the fact that saying imposter syndrome is the opposite of self-compassion. Could you expand on what you mean by that?
For several years, we've been dissecting it. We've been studying it in female physicians. It occurs some in male physicians, but we're definitely seeing a lot of prevalence within female physicians. I myself have taught lectures on it. It's a section in my book, Doctor Me First. And what I really realized is that imposter typically in our head has very negative voice. It's very, oh, I can't do this and show up. Someone's going to find out, that I'm not as good as what they think that I am. I can't believe they're paying me this much and I don't know enough. So the opposite of that would be, again, like, I think I say this to myself all the time is like, you're doing the best that you can with what you have in this time. And just recognizing the best I have today is different than my best 12 years ago. And it'll be different than 12 years in the future. But as long as I stay in this frame point and recognize what resources I have, and that changes too. When you're running on pretty thin margins, you've got a 7 week old, you're breastfeeding, you're trying to see patients, but you're up all night. You've got other children to take care of, spouses traveling. Throw all the life stuff in. I think we also have to start, again, that's where self compassion comes in like recognizing that when your margin in your life gets thin, of course, maybe you're not doing the same work that if you didn't have children or life was smooth and you weren't going through a divorce. But you can't what if yourself and beat yourself up for that because that is not the reality. And I think that's really important. There's a lot of stuff about positivity and like the quote of the day and that. And to me, it does get into toxic positivity because you're putting on those rose colored glasses and vice versa. There's a lot of times that I used like really rough self talk to be like, come on, Erin, pick yourself up. Let's go study an hour longer, finish these 5 more notes. Almost like that, like really I envision like a coach in my head that's like blowing the whistle at me and spurring me on. That willpower. Willpower is a finite skill. So I've really focused on what is the reality right now? What is truly happening around me? And when I sit down and I think about both the good, the bad, and the ugly, it's okay some days if I walk away from clinic and I got patients taken care of and I have not done one fucking note because I need to get home or I got to run a kid to a basketball game. Oh, like it's one day. But that imposter is like, oh my gosh, I didn't finish it and people are going to find out and I got notes overdue and da da. And but if I were to go tell my boss, hey, this and this is happening, my notes will get done eventually. It's just not going to happen right now. Then any reasonable person is going to see that. And so that's where I think realistically looking at our lives, which sometimes that takes an extra person, a coach, a therapist, who has the 20,000-foot view to be like, do you not recognize like how many balls you're juggling right now and you're beating yourself up about this one thing? I'm very quickly coming into the sandwich generation. So I've got kids and I've got parents. A lot of folks that's where we're at. I personally struggle with chronic medical conditions. So you throw that on board. I just got a promotion at work. So that comes with extra responsibilities. Realistic thinking is so important. And then slather that over with compassion, both for myself, for the situation, for the other complex beings that I bump into throughout the day, and for this world in general. Because yes, it is a dumpster fire. And yes, there are big, beautiful things happening as well.
I appreciate that, juxtaposition of, a dumpster fire, but there are so many beautiful things happening as well. That's life.
Mhm.
And there's the trajectory of, "This is where I want my life to be," and then there's what it is. And you're right, we need to acknowledge that, and then acknowledge the fact that, yeah, there are some days I come out of clinic and I'm lucky if I remember my name or how to get home.
Yep.
On those, at the end of the day, I walk away. The notes will get done in a timely manner, but they're not gonna be done today,
Oh,
and then
there's plenty of times I come home and I tell the kids, like, hey, mommy's going to take a nap for an hour and then we can do homework and dinner and all the things, go watch a movie. And I used to think, I'm such a bad parent. I'm such a terrible mother. But what I realized is I am literally tapped out. There's nothing less left to juice out of me. And yeah, like I gotta sleep. I gotta do something so that then I can. And luckily, my kids are old enough now. It was so much harder when they were little. I talk to everybody now. Everybody can wipe their own butts. They can use the microwave. They can pour their own drinks without spilling. Like to all those mamas out there who have small children, like I just send you a lot of light and love right now because I did not realize how hard that was going to be. And I have 3 kids that are spaced out 6 years. So it has been a hole to get. It's been 12 years to get to this point. And looking back on it, I'm like, no wonder like I was trying to rush them through bath time and I would dress them in the clothes that they were going to wear tomorrow at night. So I wouldn't have to redress them unless they like peed the bed in the morning because I was just doing the best I can and like trying to figure out innovative ways with it. We have probably ate a semi load of Pop Tarts in this house. I can't remember the last time I like cooked a breakfast for people because again, you got to pick your battles and you also have to look at the reality of what truly is important here. What truly is important and what are some things that I can just let slide. But because I wasn't making the super healthy, organic, insert whatever type of food, eliminating all plastics, I had so much mom guilt about it. And I think, again, so much imposter syndrome of I'm not being the best that I can be. But we need to scratch that idea. And it's no, you're being the best that you can be in this time with the energy and resources that you have.
oh, thank you for telling me that. Thank you for telling us that, and just thanks for bringing it up because now we're just getting down to the truth, and even thanks for bringing that up because life gets hard, and there's this idea of perfectionism to be perfect in every aspect of life. Like everybody has to be a Pinterest mom, and you have to have a house that looks immaculate, like on the magazine cover. And yeah, my house looks like my kids live here because you
Mhm.
have their artwork on the wall and you have their
Yep.
toys all over the place. And
I literally have, look at this post note. on my desk. Look at this shit all behind me. I know you guys are podcasting. You can't see it. But that's one reason, like, I just keep it real. I hate when I go on a podcast and either they have the fakey background or they have a very curated setup because I'm like, what are you hiding? What's behind the screen? You know what I mean? Because I think more of us, if we could just authentically say, fuck it, this is who I am, this is how I'm showing up, I'm doing the best that I can right now, then we would be more easily ready to accept help too. That's one thing I've learned is when you stop hiding and then when people offer things that you truly need, you're like, oh, thank God, I definitely need that. Or also on the flip side, when people see like how very real you are, and I don't spread my whole life story to my patients, but many of them know why I don't carry a full schedule is because of my own health, that it's a connection like that no other. And it almost gives them permission to be like, if Dr. Wiseman can do that, then I can do that too. And just recognizing that we are all just trying to cope and get through. I don't care who you are fighting your own battles. And though they may look different and sound different than others, you're still in it right now. This life is not easy.
Life is not easy. Life is not easy, and it's not easy to be in a perfectionistic profession.
Hmm.
But like you said, acknowledging the fact that you're doing the best that you can with what you have in that time and space is really key, and is something that is completely not taught to us in any of our training, I don't think.
No, no. I think that's why I have my program Burnt Out to Badass and why I continually talk about burnout because friend, I didn't just have one burnout and then like now it's all like rainbows and sunshine and like no problems. I haven't gotten as deep as that first event of burnout where I did have suicidal ideation. I did have a plan. I was grasping for straws to figure out like how can I be out of pain. Now what it looks like is I have those red flags when I know like I'm overworking. Oh, my brain's going back into that mode where it's not in a great place and I can make those shifts. But I hate going on podcasts or I hate listening to other people's stories who come on and they like have this huge, like the adventurer's tale. They go and do it and then they like have their happy ending. And I guess like my pearl of wisdom today for everybody is there is no fucking happy ending. You just keep going. It's just the next best step. And yes, I can say I have come back better. I do practice medicine differently. But even in this newest iteration of myself, this newest chapter, like I'm still continuing at times to just the other day, for example, about a month ago, I was bringing a lot of stuff home. I had taken my addiction boards at the beginning of the month. So I had put a lot of the like non-essential work behind. So I was like 6 months behind on chart reviews for my nurse practitioners. And I had done modules you got to do for work, like the clicky boxes and answer the questions. Like,
Yeah.
haven't done any of them all year. And that's typically not like me. I usually try to get them done by the deadline. But now that I was through my addiction board, I was like, okay, I got to do all the things. But what I realized was I was telling myself that because I was avoiding being at home because there was hard things happening at home. And I was like legitimizing my overwork at that point because work is my drug. And that's how, when I feel productive, then I feel okay. It numbs all those feelings. It numbs all those thoughts about like how hard life is. And I was like, whoa, like I'm charting at 11 o'clock at night. You said you would never do this again, Errin. Like I had to physically stop and be like, what's going on here? And name it to tame it and recognize it. So like, I really want to tell all of your listeners that like on the internet, you can Google me, you can go to my websites. It looks amazing and stuff, but like the real true story is I'm like 10 steps ahead of you. That's it. I have a little bit of extra voodoo magic that you haven't gotten to your brain yet, but there is no perfect. And I think I just really want to address that because I think there's a lot of life coaches out there who like paint this rainbows and sunshine picture and get people into programs, into coaching. And then people are so sorely disappointed. Like, where's my fucking sunshine? And what I have to tell you is it's like micro steps. It's those small changes. It's the being able to recognize when you're starting to get crispy around the edges with burnout and be like, we don't do that anymore. Okay, what do I need to shift and change? What do I need to say no to? What do I need to bring more into my life? Who needs to be out of my life and who needs to be in more? Like all those little things. Because there is no cure for burnout in today's world. If you practice medicine, there's no cure. I don't care if you find the perfect job in the perfect organization in the perfect location with the perfect people you work with, it does not exist. So instead, we need to give ourselves a pass and be like, again, like, how can I do my best work in the time and space that I'm in with the best resources that I have available to me? And take off that expectation of it's better somewhere else or, oh, they have it easier because they're at insert big institution name. It's bullshit.
Yeah, I thank you for saying that because the grass is always greener on the other side. Every place has their own issues. But the thing
Well,
is,
we're in the rural areas. If the grass is greener, it's because it's got more shit on it than ours.
literally, yes.
Literally.
And I honestly, I wouldn't trade working rural medicine for anything. I love the craziness. I absolutely adore the patients. It's my responsibility to know what I will do and what I won't do because the system doesn't care about us.
Yes. And I think everyone needs to recognize that. Like, I'm an old millennial. I reckon I kind of align with Gen X, but I also align with millennials as well. And they talk about like, everybody got a trophy and that kind of thing. And as I'm working with the younger residents and med students that are coming up, that is one thing that I continually tell them is, okay, your parents love you. They don't work here. No one gives a shit about some of this stuff. And I'm sorry, but that is the hard, true reality. Hopefully your generation can help us change that. But as of right now, you have to advocate for yourself.
Yes.
You have to know when to say no. You have to have boundaries. And also, you've got to recognize that no one's coming to save you. That was a huge thing in my own burnout when I recognized no one's going to save you. You got to be your own damn superhero. And what are you going to do about it? Because it is true. No one's going to be counting your hours anymore at work. Nobody cares how late you're staying up at night doing charting. They can look and they can know, but are they going to approach you about it? Probably not.
No.
I literally just did a contract read through she's a nurse practitioner that's starting a new job. And I'm like, I told her, I was like, you need to think about a moving stipend. You need to think about a cost of living raise written into your contract. You need to think about a retention bonus. She's but those aren't in the contract. And I'm like, you're right, because they don't give a shit and they're not going to tell you that's an option.
So for the listeners, I would highly recommend to listen to these things because as you go to negotiate a contract, definitely a lawyer is definitely worth the money. But look at these things and actually take this practical advice because you have to be your own advocate in every realm and at every step because gone are the days where they actually give a shit about the well-being of physicians. We have to care about our own well-being. And thank you for saying that because yeah, they can look, but they're not going to say, "Oh, Dr. Weisman or Dr. Shahak, I'm so sorry that you were up at midnight charting or going over labs." The thing is that as long as the charts are done, they're being able to be submitted
And build. I mean,
and
it's the
build.
billing. That's all they care about.
Right.
Yeah. I think this is what has helped me take days off is no one's going to come to me and say, Dr. Wiseman, you just look tired. And have you thought about taking a mental health day? I have some people who recognize that. But like on the general, people aren't going to do that. You just have to step up and call in and be like, I'm not coming in today. Or one thing I highly encourage all the listeners to do, I quarterly plan ahead to take days off, whether or not I have anything scheduled or not. Because yes, every couple months you need a break. And let's be honest, vacations with kids are not restful. So I highly encourage people take that time off quarterly when the kids are in school or they go to daycare or they're away. So you could just literally sit at home in your pajamas and drink a whole pot of coffee and watch Netflix for 6 hours. That is totally acceptable. They're your days off. Again, doing this contract negotiation, the scale, her day, her hours, if she doesn't use them, she loses them. There's no rollover. So that was one of the things I told her. I was like, you use every fucking hour that they give you. Go ahead and plan it all out. And I know that's scary for folks who are paid on the almighty RVU. And also, it's so important. Rest, recovery is so important. My saying is, and I'm writing a book on it right now, if work is your drug, rest is your detox. Rest is your recovery. You must have it in your life because guess what? If you just work and work, going back to where we started this conversation, if I work hard enough, everything will work out is a false statement. If you work hard enough or harder and harder, you will burn out. You will become severely depressed, have major anxiety, insomnia, physical, mental, emotional, spiritual issues. So it's not about the work. And we also need to really define like what is healthy work as well. For me, a full FTE is not healthy work. I don't think a full FTE is healthy for anybody because let's be honest, a full FTE in doctor speak is like 2 jobs in other sectors of work.
I have an attending from residency that she jokes around with me. I say I work part-time, and she goes, "So you work full-time as a doctor?"
Yeah.
Because she reiterated exactly what you said, that working as a full-time doctor is working 2 full-time jobs, and then you
Mhm.
add life on top of that. So, yeah, I don't ever see myself going back to full-time, and if I do decide to, it's because that is my choice, but right now, the way what I'm doing is, it's sustainable. It's
And that's the other thing is like giving yourself permission to change. Like your life, your children, your family, the world at large is going to look so different in 5 years. Like staying at one place and getting the gold watch at retirement just is not realistic anymore. We need to give ourselves a chance to say, if it stays good, great. And if things change, I can change with them. Because I deal with so much like guilt and shame with folks who they honestly need to change jobs. They need to do something very different. But there's something that's built into us that loyalty, that sense of serving. This is the only thing that I can do. And I just want to call bullshit on that. No, you can make iterations and changes. And again, we're doing a science experiment on ourselves. We're doing an if then statement. If I go part time, then I'll feel better. We'll put it into action and see what happens. You got to do the fucking experiment. And if that changes, because that's what's happened in my own life with a job, I was part time and then I was like, yeah, it still doesn't feel right. And it's so important to establish, reintroduce yourself to that like little small voice, that feeling, that thing inside of you that we like to call your gut, because she's one smart bitch. Like there's things sometimes. Been recently house searching. I went into a house, I loved it. And then I crawled under the crawl space, which my realtor laughed at me. But I'm like, no, I want to see. And I'm like, I don't know what is wrong down here, but I just got a feeling stuff was bad. Got the inspection report. Yep. Major foundation issues. My gut knew what she was poking at me about. And I think that only comes from a place of where you have margin and you have time to sit with yourself. If you're so busy and running like a chicken with your head cut off, you don't have the time or space to even realize those cues that you're getting.
That's so insightful. It really is. We have to sit and be able to listen to ourselves.
And hello, we're humans. We're going to have emotions and feelings and thoughts. Like just as your heart beats, your brain's going to have thousands and thousands of thoughts. They don't mean that they're all true. I think that's an important thing to remember too. And so it's going back to be like, what's the real reality happening here, brain? Are you just like catastrophizing a situation? Because I don't know, my kids love the movie Inside Out. I do too. There's a second one coming out, which I'm
Hmm.
really excited about. But it's just this emotion like really tuned up right now. And so that's where all my thoughts are going. Maybe. And so that's important to recognize too. But you can only do that when you unbusy yourself. And I'll be honest, that's like the hardest thing to do because it's so much easier to like read a self help book, listen to all the podcasts, do deep clean your house. I find when I do try to sit still and I know I need to to do that, that's when I'm like, oh, let's clean out the bathroom closet. So one of my life hacks is I have a lot of farm animals and getting outside, getting into nature, interacting with creatures really helps me to slow my brain to be with myself. Maybe doing farm chores. It's actually called green care. You can Google it. It's a thing. Just like equestrian or equine therapy. It's like green therapy, but it's about getting out into nature, taking care of something else, be it on the farm or if you're in a more urban area, having a little porch garden, which I know a lot of folks did in COVID. There's now science that's showing that if you're not a yoga meditation person like me, then maybe introducing some of this green therapy in your life is what you need to focus on a little more. I'm not into spas. I don't want to go get a fucking facial or a pedicure. That's not my jam. But I know that I go outside and just I love mowing grass because you're just sitting there and I'm doing something, but yet I'm also processing my thoughts as well. So I've really gotten away from earbuds in all the time, or I've slowed down on my podcast listening, or I do Audible or ebooks. I've really purposely made myself stop multitasking like that so that when I am doing something, I can just be with my thoughts.
No, thank you for that. And I share the same sentiment. Mowing the grass is one of my favorite things because it's just quiet time.
Mhm.
It's just quiet time and you can process a lot that but what that is an example of is something that's gonna be on the schedule that you look forward to, and you are going to be alone with your thoughts. If nothing else, that's quote unquote "white space."
It's the same thing for hiking. I do
Oh,
that. I kayak by myself as well. For me, I have to pair some kind of motion with alone time. And maybe one day I will settle in more to meditation and into some of these other activities, but I've found my recipe and I'm going to keep doing it. So I'm
yeah.
going to share it with everybody. Ingredient number one is rest, true rest, not just a weekend nap on Sunday, but really real, true recovery type rest. And that could be large or small. I've taken sabbaticals. I help people set up sabbaticals and do them well. Number two is connection with nature and animals. Super important for me. Like I mentioned, the green therapy. Number three recipe for me is self compassion, which we talked a whole bunch about earlier. And the last one is community. I can't tell you how important it is for me to have like minded people who get me, who accept me where I'm at. That doesn't always happen in our real communities. I've had to really find a lot of online friends, people now that I could text at 2 a.m. and who have my back. That doesn't always look like the families you're born into. I know that I live in the Bible Belt, and some of my beliefs now do not interact well with the beliefs that I were brought up with. And that's okay. But it's find your tribe, find your people, love them hard. So that's my big four ingredients that are really working well for me.
I appreciate that. I appreciate that. And community in that tribe is so important. That's a protective mechanism. Everything that you said are protective mechanisms. And the tribe does not always have to be in the same geographical area. COVID showed us that we can build a tribe even virtually. So thank you for mentioning that. Where can the listeners find you and your website and your podcast?
All over the place. So it's Aaron with two R's and Wiseman spelled we is man. You Google me, you'll find all my shit. But so my podcast, I have a couple of them because podcasts are like tattoos. Once you get one, you're probably going to get some more. So my initial one that came out in 2017, it's crazy how amazing this. I call her my racehorse. She's the one that just keeps going and going. But it's Dr. Me First because it's so important for us to take care of ourselves. And so Dr. Me First, we are well into, I think, 450 episodes at this point. Don't even start back at the beginning. They were awful then. Just catch up with me now. My other one is called Burnt Out to Badass. It drops a season each year. So we're going into season 4 on it. And it's all about telling burnout stories and not just doctor burnout stories, but from all sorts of people and finding out what those people's recipes were to come through it. Because I think it's so important to know there are many roads to recovery. And there's many roads to flourishing. And so same thing, websites are the same, drbeavers.com, birdtoutsbadass.com. If you're interested in being in my community, because I love my people and I hold them close, we just do a Slack group. I don't like Facebook. It's too fucking loud. So we just do a real small Slack. I think we're about 250 members strong now. And it's just fun to be able to pop in there and ask questions, get support. People ask, hey, has anybody dealt with XYZ? And I guarantee probably somebody has, or at least I know somebody to point you into the right direction. And I think that's important to do as well. Again, like that community piece. And then I also do, and they're just fun, they're retreats on my farm, just to, again, to show people like what I do and see if that jives with them so that then they can take it home. And it's called the Badass Retreat because I resonate a lot with them. So if you want to come to Indiana sometime and hang out, usually we do it late summer, but looking maybe to start doing a few more a year. I had been doing 3, then life happened and got busy and I've gone down to 1, but I think I'm ready to start doing a few more.
That sounds awesome, especially a retreat on a farm. I think, again, that's just there's something natural and intuitive about that. So thank you very much, and all this will be in the show notes.
Yeah, we don't do bougie, but I will do extra. So it's a little different from all the like female physician retreats that happen at Maryville and like where you gotta spend $1,000 a night somewhere. Mine is if you you got to pay your transportation, but if you show up, it's free. Now you're probably going to be sleeping on like an air mattress and a sleeping bag. Like again, it's not bougie, but
It's just nice to cut out the all the extra noise and get back to reconnecting with
yeah.
nature. Can you reiterate your last pearl of wisdom for our listeners, please?
What pearl do I want to leave you with? I think I just want to tell people you're doing okay. You're doing okay. Even if you're in the middle of shit river and you feel like you're drowning, you're still alive. You're still fighting. Find a way to rest, but don't quit.
Thank you for that. Thank you for your time and for your multiple points of insight and just great wisdom. So if you have found this helpful, share with a friend because we could all use camaraderie.